Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
As we reported earlier in our newscast, the Lucas County coroner says an aortic dissection, that's an acute heart condition, is to blame for the death of UT basketball player Harris Haralambous.
Joining us now to explain more about this condition is Dr. Amir Kabour from St. V's Medical Center. Dr. Kabour, thank you so much for joining us.
You're welcome.
If you could, tell us exactly what is aortic dissection?
Aortic dissection is some kind of vascular problem that created a flab in the big artery which is coming out of the heart. We call it the aorta. And that flab will compromise really the blood flow into the heart and some of the other main organs in the body.
How typical is a condition like this for a young person like Haralambous?
It's very rare, but there is some kids who are probably exposed to this condition more often than the others, specifically some kids who has what we call Marfan syndrome. Specific criteria it has to fit with them to meet that condition, like very tall, some physical criteria, which is really probably this kid meets some of it. I didn't examine the patient, so I can't determine that for fact. But the aortic dissection with him probably was the main reason for death.
Are there any symptoms that might have been able to raise some red flags?
You know, at this stage, probably some kind of chest pain, trouble breathing, some headache, some discomfort basically when they are exercising. These are the most common symptoms that start with those kids. But to be honest with you, some of the kids really rarely we discover that by symptoms. They have to have some kind of special physical exam and do some testing for them to discover some of these problems. That's why physical evaluation for those kids should be necessary at early stage of their exercise.
We would presume that a fine physical specimen like a basketball player would be, you know, at the peak of health and be less likely for this to happen. Is there anything in the physiology of these prime athletes that cause them to be susceptible to this kind of thing?
You know, there's some elements these days talking about, for example, some drug use. I mean, I'm talking about prednisone or something like that. I don't think really the steroid in this case probably was the case. I'm not sure really, but that could weaken some of the arteries and could increase the chance for some dissection in some of the kids. So that's one of the things we see these days in the athletic people who use the steroid as you know, stimulating factors.
Of course, we don't know that steroids were used at all.
No, absolutely not, and I don't mean that case.
All right, Dr. Amir Kabour, thank you so much for joining us this evening.
No problem. Thank you.